Welcome to Fairview Home Infusion. In this video, we will instruct you on how to properly administer your medication by using the IV medicine ball. This device is sometimes called an elastomeric device or a home pump. This type of IV infusion device is disposable, portable, and uses pressure to deliver medication in a preset amount of time, from 30 minutes to 24 hours. Its lightweight, non-electric design allows for patient mobility without alarms, IV poles, power cords, or batteries. Administering medication with the medicine ball is safe with proper instruction. Watch this video as many times as you need and encourage your caregivers and family to watch the video with you. Your medicine balls will arrive with a scheduled delivery to your home. As soon as you receive your supplies, take out your medicine balls and place them in the refrigerator as indicated on the label. It will be important to rotate your doses and use the doses in the order that they are received. Make sure that you do not put the balls in the crisper drawer, as that location is too cold. Your nurse will visit weekly and additionally as needed for catheter dressing changes and to obtain any labs that your healthcare provider has ordered. To warm the medicine ball to room temperature, remove it from the refrigerator 6 to 12 hours before the dose is due, or as directed on the label. If you forget to take your medicine ball out of the refrigerator, it is still okay to infuse. The cold medication will not hurt you, but it may feel uncomfortable and it will infuse more slowly. Never speed the warming process by microwaving or heating the pump artificially. Do not change your scheduled dosing times. Begin by preparing a clean workspace. Clean the surface with soap and water or disinfectant wipes. Allow to dry. Get your placemat out. Perform hand hygiene. Wash hands thoroughly using liquid soap and water for at least 20 seconds. Dry thoroughly with clean paper towels. Set up your space. Gather your supplies. You will need your medicine ball, 2 saline syringes, alcohol pads, hand sanitizer, and heparin if ordered. Set up your placemat on the clean area. Arrange supplies according to the placemat pictures. Review your most recent home infusion orders. Compare the label on the medicine ball with the order on the papers. Check for correct patient name and date of birth, correct drug name and dose, and look for the discard after date on the label. Inspect for any leaks or floating specks. If there are any concerns, call Fairview Home Infusion to report the issue. Wash or sanitize your hands again. Flushing the line prior to infusion. Scrub the end cap vigorously with a clean alcohol pad for 15 seconds and allow to air dry. Remove any air from the saline syringe. Twist the syringe onto the end cap with a push and twist motion. If there's a clamp on your line, open it now. Pulse flush your IV line with the saline. Push and pause until all saline is used, being careful not to push in any air. If you have any difficulty pushing the saline in, call Fairview Home Infusion. Do not attempt to flush if resistance is met. Carefully disconnect the syringe from the end cap. Be careful not to remove the blue end cap from your line. Ready to connect. Using a fresh alcohol wipe, scrub the end cap 15 seconds again and let air dry. Remove the protective cap on the end of your IV tubing connected to the medicine ball. Don't let the end of the tubing touch anything. If it does, start over with a new medicine ball and call your pharmacy to let them know one ball was wasted. Open the clamp on the medicine ball until the fluid reaches the end of the tubing. Close the clamp to prevent any fluid from leaking out. Twist the tubing onto the end cap of your IV. Open the clamp on the IV line. If your pump has a flow restrictor on the tubing, tape it to your skin now. Flow restrictors affect the flow rate of the medication. Your body heat will increase the flow of the medication. If you have a clamp on your IV line, make sure it is open too. Your medicine ball will infuse medication at the prescribed rate. The total infusion time will be printed on the label. Monitor your infusion progress by watching the ball deflating. Your infusion is complete when you see that the balloon inside the ball has deflated around the cylinder in the center of the ball. If the medicine ball does not deflate as expected, double check to make sure all clamps are open. If clamps are open and the medication is not infusing, you should call Fairview Home Infusion. Once the infusion is complete and the ball is deflated, prepare for disconnection. Wash your hands for at least 20 seconds with liquid hand soap and water or foam hand sanitizer. Close the clamp, disconnect the tubing. Always make sure that the blue end cap stays attached to your IV line. Prepare to flush. Using a fresh alcohol pad, scrub the blue end cap for 15 seconds and allow to air dry. Remove the protective cap from the saline syringe. Remove any air from the syringe. Attach the syringe to the cap on the end of the IV tubing with a twisting motion. Using the push-pause method, flush the saline until the syringe is empty. Twist the syringe off the end of the line. Be careful not to twist off the blue end cap. Some patients only need to flush with saline. If you have orders to flush with heparin or citrate, scrub the blue end cap again with an alcohol pad for a full 15 seconds and allow to air dry. Remove the protective cap from the syringe and remove any air. Twist the pre-filled syringe onto the blue end cap. Flush using the push-pause method. If your line has a clamp, please close it now. Discard all used supplies into the household garbage. Wash hands again. Prior to your next infusion, be sure to take another medicine ball out of the refrigerator to allow the appropriate time needed to warm to room temperature. Reasons to call Fairview Home Infusion. If your dressing is peeling off or gets wet, if you notice that your tubing has migrated or moved, if you have any problems at all, please call 612-672-2233. If you have any questions or concerns at all while administering the medication, we have specialty pharmacists and nurses on call and available 24 hours a day, 7 days a week. And in the event of an emergency, always call 911. Thank you for watching this Fairview Home Infusion educational video. We welcome your feedback. Please like this video or leave a comment below.